Hey all, welcome to Share Trek. This is Raj here. Friends, today I'm going to talk to you about a therapy from Gilead Sciences. It's called Primitigravir, also known as GS9131. But before I begin that, I want to talk to you about relativeness of various things in this universe so that we can put everything to the right perspective. So with that said, let's get started. Welcome back, friends. As I said, context is everything. Everything is relative to everything else. The other day I was watching YouTube and I like space-related information. So I also have a telescope. I do star watching from time to time, look at planets and other things. I was really touched by the fact that the universe is so huge. So I was looking at this video which was talking about a star which has become a red giant, and adjacent to it there is a white dwarf. Our sun will become a white dwarf after 4.5 billion years or so, something like that. And a white dwarf is a very small, dense, white colored, heavy star. And it has lost all the hydrogen, that's why it's become a white dwarf. Now the red giant is very huge. The gases are coming out because its gravity is not strong enough to hold all the gases. So the red giant means that the star, which was much smaller earlier, has now expanded 3 or 4 times its size, and the flames are coming out, the gases are coming out. So this particular red giant has been feeding the white dwarf a lot of its gases. And once in every 80 years, the gases that was accumulated by the white dwarf put so much pressure on its center core that there's an explosion. And we are supposed to see the explosion anytime now. And this comes to us from somewhere around maybe 2,500 light years away. So basically the light that we are going to see is coming from an event that happened 2,500 years ago. And the light took that many years to reach us. Can you imagine that? Now, if you have listened to U2, it's U2, which is one of my favorite bands, and U2 has got a song called Iris. Even in Iris, the singer talks about a light from a star that came from 1,000 years and entered the eye. So these are all indications of how gigantic the universe is, how gigantic the distances are, how gigantic the sizes are, and the amount of duration of time that it takes to travel from one planet to another, from one star to another, is our multiple lifetimes. So if you look at the other side of it, like if you look at the life of a fly, maybe it has a life of 15 days. The life of probably an earthworm is even lesser than that. The life of dogs is around 17 to 18 years on an average. So you look at all these lifetimes, and that gives you a good perspective. And I think as humans, we don't have too long a life, nor too short a life. It's just about it. And in terms of fragility, right? All of us are so fragile. We are just hanging on to a huge rock that is hurtling through space. And it's the atmosphere that is saving us and giving us life and sustenance. And the sun is giving us the light and transferring energy through photosynthesis to create all the plants which animals eat, and then we eat the plants and the animals, and we are all surviving and thriving out here. So please keep that in mind when you look at your own condition with HIV. And I would say the same thing to anyone who has a kidney disease or the heart disease or maybe diabetes. All of these diseases, they all make us even more fragile. But still, at the very base, we have developed enough medical technology to prolong human life. So if you just go back to maybe 200 years, the average life expectancy was around 32 to 34 years. And then it became 45 to 47 years. And of late, people can survive all the way up to maybe in their late 80s in the developed world, and probably in the mid 70s in the less developed world. So technologies are growing, and we have got a better understanding of our body and how it interacts with all the environment. And we have cures for many things. We have controls for many diseases. So we can live longer and better life and better quality of life, better surgery, better equipment, everything. So keep that in mind, my friends, while I launch into this information about Primitigravir, which is also known as GS9131, which is an investigational antiretroviral drug being developed for the treatment of HIV-1 infection. It belongs to a class of drugs known as nucleoside reverse transcriptase inhibitors, or NRTIs. These drugs work by inhibiting the reverse transcription enzyme, which is essential for replication of HIV. By blocking this enzyme, Primitigravir helps prevent the virus from multiplying and can reduce the amount of HIV in the blood. The mechanism by which Primitigravir inhibits HIV replication involves several key steps. So let us just look at how the HIV gets into the body. Just a quick revision for people who are watching a HIV video for the first time. HIV enters a host cell, typically a CD4 plus T cell, by binding to the CD4 receptor and co-receptor CCR5 or CXCR4 on the cell surface. And then once that binding happens, then GP120 dissolves and GP41 injects the viral RNA into the CD4 T cell. And once inside the cell, the RNA undergoes reverse transcription. The reverse transcriptase enzyme then converts this viral RNA into DNA. This is a crucial step for HIV's replication cycle, because if it did not convert it into DNA, then embedding into the host DNA would not be possible, and future copies of that would not be made. So this is where Primitigravir acts as a nucleoside analog. It is structurally similar to the natural nucleotides that reverse transcriptase enzymes use to synthesize viral DNA when Primitigravir is incorporated into the growing viral DNA chain by reverse transcriptase. It causes premature chain termination. This is because Primitigravir lacks the necessary components to form the next phosphodiester bond in the DNA chain, effectively halting further DNA synthesis. Now let's talk integration. Normally, the newly synthesized viral DNA would integrate into the host cell's genome. However, with Primitigravir causing chain termination, the viral DNA synthesis is incomplete and integration is prevented. As you can see in this video I have up here, each link in the chain has got a hook on each side so that the next one can connect to it, and that's how the link is formed. And the actual nucleotide has got links on both sides so that it can be attached, but the Primitigravir has got hook on only one side, so the next side cannot be connected. So the synthesis remains incomplete. Well, that was my in-house animation. I hope that is good enough to understand how this works. So because of this, by inhibiting the reverse transcriptase enzyme and preventing the formation of the complete viral DNA by terminating the link abruptly, Primitigravir significantly reduces the replication of HIV within the host cell. And this leads to a lower viral load in the patient's blood and helps to maintain immune functions. Primitigravir is being developed by Gilead Sciences, and I would say that Gilead Sciences is a biopharmaceutical company known for its work in HIV or AIDS treatment and prevention, and they have a huge number of therapies which are part of regular ART. And Gilead has sponsored several clinical trials to evaluate the safety, efficacy, and pharmacokinetics of Primitigravir in different populations, including treatment-naive patients and those with multi-drug resistant HIV-1. As of the latest information available, Primitigravir has shown promising results in early phase clinical trials, and I've just compiled a summary of the various information available regarding clinical trials. So it seems that for phase 1 clinical trials, the initial trials focused on assessing the safety and tolerability and pharmacokinetics of Primitigravir in healthy volunteers, and these trials provided the foundation for further studies in HIV-infected individuals. Move on to phase 2 trials. Subsequent trials in phase 2 evaluated the efficacy of Primitigravir in collaboration with other antiretroviral drugs, and these studies aim to determine the optimal dosing and to assess the drug's effectiveness in reducing viral load in treatment-naive and treatment-experienced patients. And then moving on to phase 3 trials, these are large-scale trials designed to confirm the efficacy and safety of Primitigravir in a broader population. The outcomes of these trials will be critical for regulatory approval and eventual market release. So we're waiting for that. And Gilead has reported positive results from ongoing trials indicating that Primitigravir is effective against multi-drug resistant HIV-1 strain, and the drug has demonstrated a favorable safety profile with manageable side effects. For the most up-to-date information on the status of Primitigраvir's clinical trials, I would encourage you to refer to clinical trial registries like clinicaltrials.gov or check Gilead Sciences' official announcement and publications on their website. So friends, that is a summary of what is happening with Primitigravir, and that brings to an end today's video. And I'm sure that most of you are absolutely optimistic and upbeat about the possibilities of a HIV therapy coming up very soon to get rid of this HIV menace once and for all. But for those who are a bit shaky and those who are anxious, I would say that there is no point being afraid. What has happened. Now look forward to what is the possibility. Don't let the past, don't let HIV hold you back from other achievements that you can do. There is no inhibition on this except the limitations that you put on yourself. Just go ahead, enjoy life, and achieve whatever you want to achieve, whether it's professional, in sports, or whatever it may be. Wishing you a very, very nice day, and I'll catch up with you again in the next video. Bye for now. And before I leave, a big thanks to the sponsors and members who help keep the lights on this channel. See you later. Bye for now.